Hello everyone. I hope I'm clearly visible and audible to you guys. I am Dr. Priyanka Sachdev here and I welcome you all for today's session. So in this session, I am going to teach you a very important disease, a very important pathology that is diabetes mellitus. I'm going to teach you diabetes mellitus in a very unique way. So what is unique in that? I will teach you diabetes mellitus in a integrated way. What do you mean by integrated way? So I will teach you the pathogenesis starting from physiology. First, I will teach you the anatomy of pancreas, then the physiology of insulin. Then I will come on the pathogenesis of type 1, type 2, all diabetes mellitus, then the clinical features, complications, everything. And not only this, in the end, we will study the pharmacology portion also, which is very important. That is anti-diabetic drugs or oral hypoglycemic agents along with the various insulins, right? So we will study diabetes from all the subjects wherever applicable, not only from pathology point of view. So that is the thing. So I'm going to teach you diabetes mellitus in an integrated fashion in multiple sessions. So let me start. This is the first session of diabetes mellitus. So let me start. Now we know that human has pancreas. Can you see a human body? Of course you can. Can you see a pancreas inside a human body? Can you see this pancreas is intra-abdominal organ? No, anatomically it is one organ, but histologically and functionally pancreas is having a dual function. What is the dual function of the pancreas? Pancreas is having two parts. One is exocrine part, one is endocrine part. So what do you mean by exocrine part and endocrine part? Exocrine portion of the pancreas secrete enzymes and these enzymes are useful in digestion, right? The endocrine portion of the pancreas secretes hormones, insulin, glucagon, and these hormones are useful, are required for maintaining a homeostasis in the blood and tissue glucose level, right? So we have enzymes, we have hormones which are secreted from corresponding exocrine and endocrine part of the pancreas. Okay, so pancreas, although you can see it is one organ anatomically, but histologically and functionally it is having two functions. And histologically also these are the two portions of the pancreas. Can you see this is the same pancreas? If I'm cutting it and making a slide of it, you can see in the slide what are the portions in the slide. Can you see these ducts? These are the ducts. These are the ducts and these ducts are known as these ducts are secreting, it is the exocrine part, and they secrete enzymes. These are known as acini. These ducts are known as acini. It is the exocrine part, but this is not my concern today. I'm not going to teach you exocrine part today. Exocrine portion pathology of pancreas is different, but I'm not going to teach you that today. Today I'm interested in endocrine part of the pancreas. So where is the endocrine part of the pancreas? This one is the endocrine part of the pancreas. Can you see endocrine part of the pancreas is known as islet of Langerhans. The S is silent, right? It is known as islet of Langerhans. It is a collection of multiple cells. There are basically four types of cells. The four different type of cells are there. I will tell you the names and they secrete four different hormones. So can you see this is the endocrine portion. It is known as islet of Langerhans, endocrine, right? It secretes hormones. It secretes hormones and this is the acini. It is the exocrine part. It secretes enzyme. So histologically, pancreas is having two different portions. It is in front of you. I am interested in this portion, the islet of Langerhans. As I told you, this is acini. As I have already told you, this is acini, but I'm not going to teach you acini. These are the ducts which secrete enzymes, right? And this portion in the center, this one is islet of Langerhans. In the islet of Langerhans, there are four cells. What are the four cells? Alpha cell, beta cell, delta cell, pancreatic polypeptide cell. So these are the four types of cells which secrete four different types of hormones in blood. So alpha cell secrete glucagon, beta cell secrete insulin, delta cell secretes somatostatin, and pancreatic polypeptide cells secrete pancreatic polypeptide PP, right? So these are the four different hormones secreted by four different type of cells in islet of Langerhans. So you can see alpha, this is the delta cell, this is beta cell, you can see alpha cell. So alpha, beta, delta, we have various types of cells, right? These are the four major cells. Apart from it, we have two minor cells also. So this portion I am going to teach you today, that is islet of Langerhans. Islet of Langerhans I am going to teach you today, which is having various types of cells, right? Now how you will prove that this islet of Langerhans is a collection of four different type of cells? Four major and two minor also. So I'm interested in major. So how you will prove? You have to prove it with the help of immunoperoxide staining. So what basically we do? We will take antibodies. We will take antibodies against different hormones. As I have told you, alpha cells secrete glucagon. So please take antibodies against the glucagon. So glucagon antibodies will go and bind with alpha cells only. So this is the same collection of islet of Langerhans. This is the same collection of islet of Langerhans, and this is also the same collection of islet of Langerhans. Multiple cells are collected. You can see three different diagrams of the same islet of Langerhans, but I have used different antibodies. If I am using antibodies of insulin, it will stain beta cell. If I am using antibodies of glucagon, it will stain alpha cell. And if I am using antibodies against somatostatin, it is staining delta cells. So you can see in the three diagrams, maximum cells are beta cells, after that alpha cells, and after that delta cells. So various cells are stained. It is in front of you. You can make it out. These all brown cells are beta cells, these all brown cells are alpha cells, and these are the delta cells. We are using different stained antibodies. So it is known as immunoperoxide staining. We can see, right? So the same thing is written. You can read it. We can see the various types of cell using electron microscope also. So in the electron microscope, the various types of cells are visible to you. These are beta cells, these are alpha cells, and these are delta cells. So they have little bit change in their structure, right? Okay, let me move ahead. You can see the beta cells have characteristic granules, each containing a dense and rectangular core halo. You can see these are the beta cells, right? Alpha cells and delta cells also have granules, but it is somewhat different. The structure is different. Okay, we don't want to go in detail in structure. These are the four major cells. Apart from it, we have two minor cells also. So what are the two minor cells? D1 cells and enterochromaffin cells. T1 cells secrete a hormone known as VIP, vasoactive intestinal polypeptide, and enterochromaffin cells secrete a hormone known as serotonin. So total, so let me come on diabetes. Before that, let me revise what we have studied in pancreas. So we have studied human have pancreas. Okay. In pancreas, although anatomically it is a single organ, but histologically and functionally it is having double function. It is having dual function. So what is the dual function of the pancreas? It is having endocrine part and it is having exocrine part, right? The endocrine part I am interested. It is known as islet of Langerhans. Langerhans, and it secretes hormones. It secretes hormones. I am interested in that. Exocrine part is known as SC9 and it secretes enzymes. It secretes enzymes. I am not going to teach you exocrine part. Let me come on endocrine part. In endocrine part, in islet of Langerhans, there are total 6 cells, the 4 major and 2 minor. Alpha, beta, delta, and PP are the 4 major cells. VIP and enterochromaffin are the 2 minor cells. Which hormone they are secreting? Can you name the hormone? Okay. Alpha cells secrete glucagon, beta cells secrete insulin, delta cells secrete somatostatin, and pancreatic polypeptide secrete pancreatic polypeptide. VIP cells, actually these are the D1 cells. I have written it incorrectly. D1 cells. So D1 cells secrete VIP. They secrete VIP, vasoactive intestinal polypeptide, and enterochromaffin cells secrete serotonin. So please have a look on it. We have understood it. Now let's move on diabetes. So if you know the anatomy of the pancreas and histology of the pancreas, understanding diabetes will be very easy for you. I am teaching you diabetes mellitus, right? Not diabetes insipidus. I am teaching you diabetes mellitus. So what do you mean by diabetes mellitus? What do you mean by diabetes mellitus? In diabetes mellitus, it is a group of disorder which have one feature, that is hyperglycemia. What do you mean by hyperglycemia? What do you mean by that? Hyper means more, glycemia means glucose. Glycemia means glucose. So the individual, the person will have more glucose level in the blood. More glucose in the blood. That is the disease known as hyperglycemia. So diabetes mellitus is diagnosed when the blood glucose level become too high. So what is the normal blood glucose level? When you will call it high? What is the normal blood glucose level? So if you talk about normal blood glucose level, if you are fasting, by fasting I mean from the last 8 hours I have not eaten anything. So it is known as fasting. So fasting blood glucose level, normal level is 80 to 100. 80 to 100 grams per deciliter. This is normal blood, right? And if you are post meal, if you have eaten your meal, taken your meal, and you are measuring it after 2 hours after the meal, so what is the normal range? Normal range for that, so normal range for that will be up to 140. Up to 140 it will be normal. Less than 140 is normal. Have you got it? So this is the normal. So I have taken my breakfast in the morning. So if you check my blood sugar level, it will be 100 to 140 ke beech mein. Okay, I am not diabetic, right? If I am fasting in the morning, if you check my blood glucose level, it is 80 to 100, right? So but when blood glucose level becomes too high, now both will increase. The fasting will also increase and postprandial will also high. So the person is diagnosed as, I will tell you the criteria. From which point, what is the critical criteria above which you will call the person as diabetes? 100 से 125 के बीच में it will be pre-diabetic. If it is more than 126, it will be diabetic. 140 से 199, it will be pre-diabetic. More than 200 is diabetic. So we have three range: normal, pre-diabetic, diabetic. We will come on all these points in diagnosis of diabetes, but let's understand the definition of diabetes. So what is definition of diabetes? It is hyperglycemia. Hyper means more, glycemia means glucose level. So it is more glucose level in the blood, that is hyperglycemia. Now, who regulates the blood glucose level? Now, can you see a beautiful diagram I have drawn for you? Can you see in this diagram? In this diagram, this is the blood vessel of a human being. These are the cells of the human being of various organs. These are the cells, right? So there is a homeostasis in the glucose level between the blood and the cell, which is maintained by two hormones. The two hormones are insulin and glucagon. We already know that insulin is secreted by beta cells of the pancreas and glucagon is secreted by alpha cells of the pancreas. Yes or no? Yes, we already know it. So insulin and glucagon are the two hormones which are secreted by alpha and beta cells of the pancreas respectively, right? Now see the arrows. See the arrows. Look at the arrows. So insulin is the hormone which transfer. See the arrow. It is transferring the blood glucose level into the cell. So glucose from the blood is transferred into the cell and is stored in the cell in the form of the glucagon. No, glycogen. Glycogen. It will be stored in the cell in the form of the glycogen as the storage form of the glucose. So basically, insulin is decreasing blood glucose level. It is shifting the glucose from the blood to the cell. Glucagon is doing just reverse. Glucagon secreted by alpha cell of the pancreas, it is doing just reverse. It is splitting the glycogen from the cell and moving it to the blood. So moving it to the blood, so glucagon is increasing blood glucose level, right? So humans have a capacity to decrease blood glucose level and to increase blood glucose level according to the need. According to the need, we can increase and decrease our blood glucose level, but it is maintained within normal range. What do you mean by according to the need? Just suppose if a person is fasting from the last 8 hours, I have not eaten anything, so my blood glucose level will fall, but body do not want that. It will fall below 80, below 70, so my brain will get less glucose. So body do not want that, human body do not want that. So at that time, during fasting state, glucagon will come in role. Glucagon will come in role and glucagon will shift the glycogen into the blood and increase the blood glucose level, because we are fasting from last 8 hours. And reverse will happen just after the meal. If I am having my breakfast, lunch, dinner, these are the three major meals normal human beings take. So after breakfast, lunch or dinner, if I am eating anything, the food is going in my GIT. From the food, the glucose is absorbed from the GIT and the glucose will go in blood. So immediately after meal, my blood glucose level increases tremendously. Body do not want hyperglycemia also. So at that time, insulin will come in role and insulin will shift all the glucose present in the blood into the cell. So during meal, insulin is secreted. During fasting state, glucagon is secreted. And insulin and glucagon, according to their, you look at the arrows, according to their action, they maintain normal blood glucose level. So during fasting state, we have low insulin and high glucagon. And during meals, we have high insulin and low glucagon. Looking at this diagram, you can make it out what I mean, right? I'm saying during fasting, we have high glucagon and low insulin, of course. And during meals, we have high insulin and low glucagon, of course, because you can understand what is the difference. Ultimately, we want to maintain blood glucose level between 80 to 100 grams per deciliter. This is our ultimate motto, using these two hormones throughout the day, whether we are fasting or whether we have eaten anything. In both the scenario, we want that blood glucose level should be between 80 to 100, 80 to 100 grams per deciliter. Give me a thumbs up if you got it. This is the biggest thing you have, a concept you have got it, right? Now, what is happening in diabetes? Let's come on our topic directly. What is diabetes? What is the problem in diabetes? In diabetes, we don't have any problem with glucagon. We have problem with insulin. So make a crossover insulin. Now you will say, ma'am, what is the problem with insulin? There can be two problems. Either the insulin is absent, either it is absent because it is secreted by beta cell of the pancreas. Beta cell of the pancreas are destroyed. They cannot synthesize insulin, right? So insulin is either absent in the blood or it is present but it is non-functional. It is non-functional. It cannot show its function. It is present, but it cannot shift the glucose from the blood to the cell. So glucose will remain in blood only. So this is known as quantitative defect. Quantity is less, na? And this is known as qualitative defect. So insulin can be quantitative or qualitatively defective. Either it is absent, that is quantity is less or decreased in amount, or it is present but is non-functional. So it is non-functional means insulin quality is not good, right? In both the scenario, what will be the end result? In both the, either it is absent or non-functional, it cannot shift glucose. It cannot shift glucose. See the arrow. This arrow is gone. It cannot shift glucose from blood to cell. So there will be two problems. There will be two problems. What will be the two problems? Blood glucose level will increase and cell glucose level will decrease. Both are problematic. Both are problematic. And this is the disease known as diabetes mellitus. So what is the definition of diabetes mellitus? In diabetes mellitus, insulin is either absent or it is non-functional. So in both of these scenarios, the blood glucose cannot be shifted into the cell, and blood glucose level will rise and cell glucose level will fall. You will ask, ma'am, what is the problem in that? Just suppose I am a human being and inside me, just suppose my blood glucose level is more. It is more than 100 fasting or more than 200 the postprandial. So do I have any problem with that? Now, अब मेरे अंदर blood glucose कम रहे या ज़्यादा रहे उससे मुझे technically what is the problem to me? What is the problem? Symptomatologically, do I have any problem? Yes, I will have some problems. So if blood glucose level is high tremendously for many years, for long time, it is not for one day I'm talking. For long time I'm talking about 5 years, 10 years. If blood glucose level is high, so that glucose will go in all the organs and cause damage to the organs. It is the end organ disease, right? So it will cause damage to basically three organs: the retina of the eye, right? The nerves coming from out of the brain, and the kidneys. These are the three organs which got damaged because of the high blood glucose level in the blood. Have you got it? So these are the three complications of the diabetes. You can say diabetes retinopathy, diabetes nephropathy, and diabetes neuropathy. So diabetic retinopathy, neuropathy, nephropathy. These are the most three common complications of the diabetes if the person is not treated for the diabetes. If blood glucose level remain high for many years, the three organs will damaged. They will damage permanently. Sometimes diabetic persons don't take the treatment. They say ki, yeah, blood glucose level is high. If I measure it is high, but it is not giving any trouble to me. So why I should take the treatment? Why I should take insulin? Why I should take oral hypoglycemic agents or any tablet? Why? So if the person is not taking for many years, both the kidneys will be damaged, and in the end, the person will be having chronic renal failure, bilateral renal failure, and the only option is dialysis. Person will be on dialysis, right? In nephropathy, this is the nephropathy. In neuropathy, there will be abnormal sensations overall in the body, especially in the limbs, right? In retinopathy, the retina is damaged, and you have studied that in ophthalmology, right? So that is the complication of high blood glucose level in the blood. Now, what is the complication of low glucose in the cell? The cell will have low glucose, so all the cells are starving. You know, starving. ये भूखे रह गए. They don't have glucose. Now, have you heard a proverb? दिया तले अंधेरा. Have you heard another proverb? Samundar tale pyasa. So this is the same situation. If you understand Hindi, you are getting what I mean. So this is the same situation this cell is facing. This cell cannot utilize glucose although having abundant of glucose throughout in the blood, having abundant of glucose at the right at the doorstep, but the cell cannot take it. So see the irony, see the, I am pity on this cell, see the irony of the cell. This cell is surrounded by the blood is full of glucose, but the irony is that cell cannot take that glucose. Have you got it? So that is samundar tale pyasa. So the cell will be starving for the energy. Both are problematic. So what is the problem now? You tell me. You tell me what is the problem in diabetic person? Who will tell me what is the problem in diabetic person? In a diabetic person, body have a trouble in moving glucose from blood to cell. See which arrow is gone. This arrow is gone. This is functional. So blood to cell, this cannot be done. Either due to insulin is absent, there can be two problems. Either insulin secretion is less or its action is less. Either it is present or both, right? So qualitative or quantitative effect. Now there will be two problems. Blood glucose level is high, cell glucose level is low. Both are problematic. If blood glucose is high for many years, it will cause multiple organ damage, especially three organs: retina, kidney, and nerves. Diabetic retinopathy, neuropathy, nephropathy, the three complications. And if the cell glucose level is low, so cell will starve for the energy. They cannot synthesize ATP. Despite having abundant of glucose right at the doorstep, they cannot take it. See the irony. Have you got it? So this is diabetes. This is diabetes. I hope you got the basics of the diabetes. Everyone, I want thumbs up from everyone. This was a very important concept I told you, right? Now, diabetes is the leading cause of morbidity and mortality throughout the world. These are the 5 topmost country in the world which is having highest prevalence of diabetes. Highest prevalence of diabetes, number 1 is India, number 2 is China, then US, then Indonesia, then Japan. These are the 5 countries in the world which is having highest prevalence of the diabetes. Now, on an average, if we talk about India, let's talk about India. In India, out of every 100, 7% have diabetes. So 7% is the incidence rate of the diabetes. So out of every 100, 7% are newly diagnosed as diabetes every year. Every year, out of every 100. The next 100, the next 7. Next 100, next 7. So this is the incidence rate of the diabetes in India, you can say, right? Let me come on the classification. We have understood, till now, we have understood the definition of diabetes. So this is the definition of diabetes. Don't learn the definition. Understand that in this diagram. So diabetes is a disease in which there is a problem with insulin hormone. The problem can be two. Either the hormone is absent, that is quantitative defect, or it is present but non-functional. So it is qualitative defect or both of the above. In this scenario, insulin will not shift the blood glucose level into cell. So blood glucose level will rise and cell will fall. Both are problematic. If blood glucose level will rise, it will cause damage to multiple organs, especially 3 organs. And if cell glucose level will fall, the cell will starve for the energy despite of having abundant glucose right at the doorstep. I want thumbs up in the comment box. Everyone, if you got this concept, whether you are watching it live or whether you are watching it recorded, I want a thumbs up. Do you have any doubt in this? Please write down in the chat box. I will address your doubt as soon as I will see it. Have you got it? Let's come on the classification. Let's come on the classification of the diabetes, right? Let's come on the classification of the diabetes. Diabetes is basically of two types, type 1 diabetes and type 2 diabetes. The two types I'm going to teach you in detail. So type 1 diabetes, type 2 diabetes, I will teach you both in detail. The third type of diabetes, that is genetic defect in the beta cells of the pancreas. Beta cell function ki genetic. These are known as MODY. These are known as MODY. What do you mean by full form of MODY? What is the full form of MODY? It is maturity onset diabetes of the young. MODY, maturity onset diabetes of the young. So this genetic defect diabetes are the MODYs. There are 6 type of MODYs. I will teach you all. So MODY 1, MODY 2, MODY 3, MODY 4, MODY 5 and MODY 6. I will teach you the various enzymes which are defective in these MODYs. So these are the maturity onset or genetic defect in the diabetes. I will teach you this also. Right. After that, we have genetic defect in the insulin. I'm not going to teach you this. Exocrine part of the pancreas defect. I'm not going to teach you this. Endocrinopathy, acromegaly, Cushing syndrome. I will not teach you this in detail. There are many infections which cause diabetes. So these are the organisms. These are the 3 organisms which cause damage to the beta cells of the pancreas. So beta cells of the pancreas are damaged, so the person will be diabetic. So what are the 3 infectious organisms? Learn their names. So it is cytomegalovirus, number 1, Coxsackie virus, number 2, and rubella virus, number 3. So all are viruses. There are 3 viruses which cause damage to the beta cell of the pancreas, and the person can have diabetes because of the infection. There are many drugs. There are many drugs which cause hyperglycemia in a person. So the person will have diabetes. The hyperglycemia means diabetes. Person have diabetes because of the drugs. If you stop the drugs, the blood glucose level again will become normal. So in this scenario, no treatment is required. Just stop the offending agent. Whatever is the offending agent causing the blood glucose level to rise, stop that offending agent. The person will again will be eugenic, right? So euglycemic, right? So what are the drugs? Enumerate them. It is steroid, the most common drug, the most common culprit. Steroid, thyroid hormone, interferon alpha, protease inhibitors, beta agonist. You know beta agonist. Thiazides, it is a diuretic. Nicotinic acid, phenytoin, it is an antiepileptic drug, and Vecor. So there are many others also. These are the important drugs which causes hyperglycemia. Apart from it, there are some syndromes, the genetic syndromes, which are associated with diabetes. So Down syndrome, Klinefelter syndrome, Turner syndrome, and Prader-Willi syndrome. So learn the name of these 4 syndromes. Apart from it, the last but not least, I will teach you in detail is gestational diabetes mellitus. That is diabetes during pregnancy. Diabetes during pregnancy is gestational. I will teach you this in detail. So basically, I will teach you type 1. I will teach you type 2. I will teach you genetic defects of beta cell, that is MODYs. ये तो पूरा पेज हम डिटेल में पढ़ेंगे one by one. And these I will not teach you in detail. You learn the names only. Among these, I will teach you only gestational. So I'm going to teach you these in detail. Other, you should know the classification, right? So type 1 है, type 2 है, MODIs है और gestational है. Apart from it, infections, drugs, genetic syndrome, learn this classification by yourself. So we are done with classification also. So let's start with type 1 and type 2 now. Let's start. So these are the two most important diabetes which I am going to teach you in detail. After that, we will study MODIs also. After that, we will study gestational diabetes mellitus also. Don't worry, we will study everything, right? Let me start with type 1 and type 2 first. Let me finish these two. Type 1 diabetes. What is the another name given to type 1 diabetes? Type 1 diabetes is only 10% and type 2 diabetes is 90%. Right? Type 2 is very common. Type 1 is rare. It is not very common. Type 1 diabetes is only 10%. There are two names given to type 1 diabetes. Type 1 diabetes is known as juvenile onset diabetes because most commonly it is diagnosed at younger age or adolescent age or juvenile age. It is also known as insulin dependent diabetes mellitus, IDDM, insulin dependent diabetes mellitus, because the only treatment for type 1 diabetes is insulin. Do you know insulin ka tablet nahi aata? It is not oral form. Insulin is injectable. It comes in the form of the injection and person has to take subcutaneous injection with every meal, before every meal or after every meal. So basically human take three big meal: breakfast, lunch, dinner. Right? So three times a day the person has to give injection to himself or herself, before every meal or after every meal, with every meal you can say. So insulin is an injectable drug. It is an injectable treatment. That is the only pity for these patients. So these patients has to take multiple injections throughout the day, 3 to 4 injections throughout the day. Whenever they eat, they have to take insulin, and insulin is injectable, right? Insulin is the only treatment. There is no oral hypoglycemic agent, right, for a treatment which can be given to these. So type 1 diabetes, it is only 10%. Two names are given: juvenile onset diabetes and insulin dependent diabetes mellitus. You got the meaning of both. Why it is known as juvenile? Because it is diagnosed at juvenile age, right? Why it is known as insulin dependent diabetes mellitus? Because the only treatment for these patients is insulin. Have you got it? So I am done with type 1 diabetes. Let's come on type 2 diabetes. Let's come on type 2 diabetes. Type 2 diabetes is 90% of the cases of the diabetes. 90% of the cases of the diabetes is type 2. It is known as maturity onset diabetes. मैच्योरिटी ऑनसेट डायबिटीज ऑफ यंग नहीं है, मोडी नहीं है, इट इज मैच्योरिटी. वो था जुवेनाइल ऑनसेट डायबिटीज, ये है मैच्योरिटी ऑनसेट डायबिटीज, राइट? मैच्योरिटी ऑनसेट डायबिटीज. इट इज ऑल्सो नोन एज नॉन इंसुलिन डिपेंडेंट डायबिटीज mellitus, that is NIDDM. Now this is a misnomer. Why it is a misnomer? Looking at the term, you may feel that insulin is not required for their treatment. No, this is not the case. This is not the case. It is a misnomer. Non-insulin dependent ka matlab hai insulin is not only treatment. If you diagnosed any person with type 2 diabetes, which occurs mostly after 50 years of age, 40 or 50 years of, it occurs in old age, right? Maturity onset hai. It occurs in old age, right? Middle age or old age. So if you diagnose any person with type 2 diabetes, first offer diet restriction, lifestyle modification, exercise. After that, offer oral hypoglycemic agents. There are many tablets available for that, right? Metformin is the drug of choice. And if it is not controlled, even with metformin and other oral hypoglycemic agents, even after lifestyle modification, exercise, diet control, then the last option is insulin. It is not that insulin is not given in the treatment. It is given, but it's a last resort, not as the first resort like it was in type 1. So what is the summary? Till now what we have learned? We have learned that diabetes mellitus is of two types, type 1 and type 2. Type 1 and type 2. Type 1 is 10%, type 2 is 90%, right? Type 1 is known as juvenile onset diabetes. Type 2 is known as maturity onset diabetes. Type 1 is known as insulin dependent diabetes mellitus. Type 2 is known as non-insulin dependent diabetes mellitus. Right? So that is the summary. Till now I have given you. This is a misnomer. It is not the thing that insulin is not given in the treatment. Insulin is given but as a last resort, not as the first resort. Here insulin is the only treatment. That's why it is known as insulin dependent. And juvenile and maturity is the age at which they are diagnosed, at which they occur. Right? We are done with type 1 and type 2 ka nomenclature. Let me come on the risk factors of the diabetes. There are many risk factors for the diabetes. If anyone having a family history of type 2, either the mother or the father or any family history of type 2 diabetes, the person is having higher risk of developing diabetes. My mother's maternal side, many diabetic persons are there. My paternal side also many diabetic persons are there. My both parents are diabetic. So I'm having high chances that after 50 years or 40 years, I will be diabetic. Only by taking the proper lifestyle modification, by doing exercise, diet restriction right now, starting right now, I can postpone it, but I cannot avoid it. I will be diabetic in future, I cannot neglect it, but I can postpone it as much as possible by doing lifestyle modification, right? Okay. So family history is the biggest risk factor. Obesity, if someone is obese, overweight, so he is having high risk of type 2 diabetes. I will tell you the reason why obesity increases the risk of type 2 diabetes. I will tell you pathologically what is the reason when I will teach you type 2 diabetes in detail, right? The third is physical inactivity. Nowadays, most of the having office jobs. So in office job, most of the hours the person is sitting. Even I teach for hours by sitting on a chair. So physical exercise is very less. So the sedentary lifestyle is there. So that will lead to obesity, right? And that can increase the risk of type 2 diabetes. The race and ethnicity. Blacks, Asians, and Pacific Islanders are at higher risk of diabetes because of their race and ethnicity. Previous identification of impaired glucose. So if a person is having impaired fasting blood glucose level or impaired glucose tolerance, that is a pre-diabetic person is at high risk of developing diabetes as compared to a non-diabetic person, right? History of having gestational diabetes. Imagine a lady, she got pregnant and during pregnancy she is diabetic. Before pregnancy she was not diabetic and just after delivery of the baby she become normal again, she is non-diabetic. But after 50 years of age she is having high chances of developing diabetes because she was diabetic at the time of the pregnancy. So gestational diabetes mellitus or delivering a baby heavier than 4 kg at birth. These are the risk of developing diabetes in that lady in future, right? Hypertension is a risk for diabetes. If someone is hypertensive, he is having high risk of developing diabetes in future, right? Dyslipidemia. If HDL, good cholesterol is low and LDL and triglycerides, that is bad cholesterol is high. So person is having high risk of developing diabetes, right? PCOD is a risk, right? Acanthosis nigricans is a risk and history of vascular diseases. So these are the 10 risk factors for diabetes mellitus. Please learn the risk factors, right? Okay, so let me start with diabetes now. Till now, what we have understood? Till now, what we have understood? We have understood the introduction, what is diabetes? We have understood the classification, what are the various types of diabetes? Type 1 ka detail, type 2 ka detail. Let's start the biggest thing. We have understood glucose homeostasis also with the help of two hormones, insulin and glucagon. Insulin secreted during meals and glucagon secreted during fasting state, and how insulin and glucagon together acting in human blood and maintaining normal blood glucose level. So glucose homeostasis we have already understood. The next topic which I want to start before teaching you pathogenesis of various type of diabetes is insulin regulation, the physiology. Let me teach you physiology first, then I will come on pathology and medicine and pharmacology. I will come on that. But let me teach you physiology. So how insulin is synthesized, how it is released, and after releasing, how insulin is showing its action. That is the biggest thing I want to teach you here. And after that, I will come on the pathogenesis of the diabetes. Have you got it? Have you got it? Say yes or no. Have you got it? So let me start with insulin regulation. Okay, but the link is expiring. I have to end this lecture and I will teach you. Please don't miss next lecture, part 2 of this series, right? Of this diabetes series. Please watch the part 2. In part 2, I'm going to cover all these. I'm going to cover insulin regulation. Then I will teach you the pathogenesis of type 1 and type 2 diabetes, the MODIs, various types of genetic diabetes, MODI type 1, 2, 3, 4, 5, 6, and gestational diabetes mellitus. So I will teach you pathogenesis of all of them. Not only this, I will discuss the clinical features, the triple P, polyuria, polyphagia, polydipsia, the mechanism of these three P in diabetes. I will teach you the complications of the diabetes, that is keto, acidosis, and hyperosmolar coma. The two complications, the pathogenesis of the complication, and how we diagnose diabetes in a diabetic person. And after that, we will come on the pharmacology portion, that is the treatment of the diabetes. So I'm going to take this series in 3 or 4 parts. So it is a big topic. You will cover diabetes from all 19 subjects wherever applicable, starting from anatomy till medicine surgery. I will cover everything of the diabetes. So don't dare to miss the next lecture. The link is expiring. I'm ending this lecture and please join the next lecture. Just a second, give me a minute. So thank you very much for being with me. I really enjoyed teaching you this lecture. Hopefully same, you have learned a lot from your side also. The next class, the next lecture will be after 1 hour. After 1 hour, there will be part 2 of this series, that is diabetes mellitus part 2, in which I will continue the series. Don't forget to write your feedback for this lecture. If you have learned anything, when a single line was good for you, please write down in the comment box. Your feedback is really important for me. Let me do a few announcements. That on Unacademy, this is an Unacademy lecture, right? So on Unacademy, we have two types of paid subscription. One is Plus, one is Iconic. In Plus subscription, you will get access to live and recorded lectures of Unacademy only from India's topmost educator. In Iconic, along with Unacademy, we will provide you prep ladder also. So if you are thinking of taking a paid subscription, I suggest you to take Iconic, because here you are getting everything what Plus is offering to you. But additionally, you are getting for revision the recorded prep ladder version also, right? So the price difference between the two is very less. You can do the comparison. On an academy, we are conducting tests periodically, right? So in March, this is the calendar. This is the calendar. So on 11th is done, on 12th of March, today at 4 p.m. you have a test. You have a test, right? So this is the free calendar, and okay, I suggest you to join the special classes on Unacademy platform. So this is a YouTube class for attending a special class. Special class is a free class on Unacademy app. I suggest you to install the app. Go in the Play Store, install Unacademy Learners app. After installing the app, select the category as NEET PG. NEET PG is a category for all medical students. In that category, search for my name. My name is Dr. Priyanka Sachdev. Dr. Priyanka Sachdev is my name. So please search my name under Plus Educators. You will find my name. Along with my name, you will find my profile link. I suggest you to follow my profile link. Once you follow my profile link, you will get a list of recordings which I have already taken. Just a second. A list of recordings which I have already taken for free. You can watch any of my free recording. Free recording. It is free. It is free. You don't have to take paid subscription for that. There are more than 500 free recordings of various subjects available on the app. The only thing you require a code to unlock it. What is the code? Code is my surname only. Sachdev. Sachdev. Sachdev 10. Please apply this code. If the app is asking for a code to unlock it, to open it, please apply and distribute this code to every medico throughout the world. All the medicos, please distribute this code to open any free recording on Unacademy. You can use this code, not only of me, other educators also. You can open the free recordings using this code. So please learn the code. It is Sachdev 10. Sachdev. Sachdev 10 is the code. So that is the thing, number one. And once you take the paid subscription, you will be eligible for all these batches. We have various different batches for INICT. We have various batches for NEET PG. We have various batches for FMG. So you will be eligible for all these batches. You can attend the lectures for all these batches. These are the various plans available with us. You can see in the Plus, these are the plans. The minimum is 3 months, maximum is 4 year. In Iconic, these are the plans. The minimum is 6 months and maximum is 4 year. So various plans are available with us. You can check the prices of various plans. The good news is that see the price, and if you apply my code, the same code for the free recording walai code SACHDEV Sachdev 10 before payment on any of these plans, you will get straightforward 10% discount. So don't forget to apply the code if you are thinking of any Plus or Iconic subscription. So the code is useful for all students. Sachdev 10 is the code which is useful for all students, whether you want to watch it for free, only free classes, or whether you want to take paid subscription, the Plus or Iconic. For free one, they can unlock the classes using my code, only free classes, and paid one will get the discount if you use my code. So thank you very much for being with me. Don't forget to join part 2 of diabetes mellitus. Thank you. I'm ending this lecture. Bye bye.